And you are now live.
Thank you, Arch. Welcome everyone to our FBS chat. So this evening we have Dr. Kate Walker and Dr. Emma Holdsworth, who we approached, but we'll get to that later on. And my wonderful co-host, John Hendon, solution focused, who we've had a chat before, John. So thank you for joining us.
Yes, pleasure.
I really appreciate it.
Thank you for inviting me back to be co.
You're welcome. So I generally ask how people came across the solution focused approach, Emma and Kate, but I guess for anyone watching, maybe a bit about what you're currently doing and how you got into what you're doing at the moment, because maybe people from the solution focused world may not know who you guys are, like we do. So Kate, tell us a bit about you.
So I currently work for the NHS, working with older forensic mental health patients. I'm on a part-time basis, but the other part of my work is working. I've got a consultancy business where I work with Emma, where we develop solution-focused interventions for adults mainly. Tended to be more doing it for male adults, but we have also done females as well. And we look at developing the interventions and then training individuals to deliver them. And then we also do clinical supervision, so we can support people who are training into individuals. And I kind of came to it in a bit of I don't know whether it's right to say this, I almost stumbled across it, is how I really came across it, in that I did a PhD in desistance from intimate partner violence, and developed a conceptual model of how males stop using violence in their relationships, and was very interested in the kind of self element of it and what the men themselves were doing and how they were thinking in order to stop using violence. And this is where I kind of started finding this approach of kind of looking forward and not focusing on the past and new identities as a different person. To a side of that, and Emma can tell you more about that. Emma and her colleague, Professor Erica Bowen, were working with Wiltshire Probation and actually developing solution-focused approaches and interventions, but I wasn't really involved in that at that stage. And then I was also kind of intrigued within my research background. We were delivering lots of interventions for partner violent men, but all the evidence seemed to suggest they weren't working, but we just kept delivering the same ones anyway. So I was kind of thinking, well, what are we doing wrong? Why we need some different kind of approach? So there was that. And then also as an aside, I was always very interested that in a personal point of view, my friends used to think we're really weird, and my kids actually have always thought we're a bit odd, that my husband and I have always set goals. And for years on our summer holidays, we go and set goals. And what we do is we write our goals, but we write them as if we've done them. We write the thing of that we read the following year that says, what a great year it's been. We've done this, we've achieved this, we've hit this. And then we made the children do it just to add insult to injury. But kind of putting all of that together, it kind of was screaming out solution-focused approach. And that's kind of where my interest came and how I ended up then. I've got to give credit where credit's due. I kind of jumped on Emma's good work. I said, oh, you seem to have developed some stuff. I think I'm interested in that. Can I join in, please? So that's how I came to be doing it.
Joe, we can't hear you.
I beg your pardon. I put myself on mute. I was just. What led you down that route into intimate partner violence specifically, Kate? Because I guess you could have done a PhD in most things.
Yeah, again, it was a bit of an interesting. Again, I sound like I spend my life stumbling. I stumbled across it because I was actually working in sales and I had 3 children. I was covering the whole of the UK, and it wasn't really working because the children were going feral. My husband was working away a lot, and my mum was getting a bit upset with me, saying, "Can you look after the kids at 6 o'clock? What, 6 in the evening? 6 a.m. Monday morning." So it was kind of decided that one of us needed to potentially change what we were doing work-wise. So I said to my husband, "I've always regretted not going to university." So he said, "Well, why don't you go to university, do a degree?" And I said, "I'm really interested in psychology. I could do that because I could perhaps then go down the route of organisational psychology, and that'll help my sales, and, you know, I'll come back and get a job." So I did the 3 years of a degree and was really interested in the forensic element. And it was just through going to lectures that I found this interest in it. I then said to my husband, "Oh, I know I said I'd get a job. Would you mind if I did a master's? It's only a year, and I'll do a forensic master's." And he said, yeah. So I did that, and that's where I really got into like behaviour change and violence and offending and trying to understand and help people with things like that. Then I said to my husband, "Would you mind if I didn't get a job now and I did a PhD? It's only 3 years." So that's when I did it in intimate partner violence and desistance, because by that time I'd really developed an interest in that area. And then after I did that, the good news is I did go and get myself a job. So it was only 7 years in my defence. But that's how that came about.
Oh, excellent. And what an understanding husband. Yeah, brilliant. And
yes.
Emma, how about you? How did you end up in this path?
Well, yeah, stumbling is the word. I ended up a bit like Kate, doing my degree as a mature student. I was also in sales, actually, in the motor trade, got bored and thought I need to do something else in my life. And I'd been reading some books and thought psychology sounds like the subject for me. Then I read The Jigsaw Man, which is a book by Paul Britton, and I was absolutely hooked on forensic psychology. So yeah, a bit like Kate, kind of did my degree, thought, right, need to do something more, and so then did my master's in forensic psychology. And then Professor Erica Bowen, who, as Kate was mentioning earlier, was my PhD supervisor. And just before I started doing my PhD, she asked me to be a research assistant because she'd got an invitation to do some work with the Probation Trust, because Erica's area is intimate partner violence. And so I just remember her calling me up saying, "You've got to come round. I need to show you something." So I drove round to her house and she said, "Have a look at this video." And it was a video of Sue Berg and Steve DeShazer, and said it's this thing called solution-focused therapy. This was back in 2009. I know it's not really that long ago in the grand scheme of things, but she said, "I think we could maybe use this. There's some research going on over in the US about how we could use this with helping intimate partner violent men change." And I watched this video and I was absolutely hooked. As soon as I saw it, I had that feeling of course, this is the way you have to work with people. It just completely made sense. And I just knew that was it. From then on, that this was going to be very much the heart of what I did in terms of research. And that's how it all started. So we started with the Probation Trust back in 2009. I ended up doing my PhD then on it was the development of a theory of engagement in offending behaviour programmes. Because in the research, we tend to talk about engagement. You've got to have people engaged in programmes for them to work. But there didn't seem to be a lot of agreement about what engagement actually looks like, what it means. There was no real definition. So I started looking at all the research and thought, well, some people think it's attendance, some people think it's participation. So anyway, long story short, that was my PhD, and overwhelmingly it was pointing towards solution-focused therapy is a tool for engaging. I mean, it has engagement written all over it. And if you've got engagement, as you know, you've pretty much got all you need that's all you really need. So and curiosity, of course, which are the early seeds of engagement, peak engagement. And if you can get people curious, you're really 90% of the way there. So that's, yeah, it was a bit of stumbling, but it was that very lovely feeling when you look at something and you think that's absolutely right. It's quite a lovely feeling, and I'll never forget that moment when I first came across it.
John, no pressure, over to you.
Yeah, I'm curious as to which Insukinberg video it was you saw.
I recall that it was a video, and I think there was a couple. This was right back in the early days of them using the miracle question. Yes. And working with a couple, and she was doing this amazing job of gently parking all the problem talk that was coming out from this couple. Yeah. That were and she was just gently, well, we'll just come back to that, and she would park all the problem talk and just had this lovely way. But yeah, I'm pretty sure it was based on the solution focus, on the miracle question. Yes. And how to use that in solution focused therapy. And I just remember thinking, this is just mesmerizing.
Yes, I think I've seen the same video, and I often refer to it in terms of her patience, in Sue Kimberg's patience and persistence. And what was about that struck you, and you thought, yes, we could use some of these qualities that she's got here with this couple with intimate partner violence?
It was just the way she had this wonderful, warm way of embracing people and really just gently nudging the conversation in where it needed to go without the confrontation, without any of the conflict. And as Kate has just been saying, we're so used to seeing that when working with particularly intimate partner violent people, that it just was such a refreshing idea that actually, yes, of course it would work, because you're engaging in a conversation that isn't about that doesn't engage in conflict. It's literally that very warm, person-centered approach. And then because there was this research over in the US, and they said how they had gone about using it and adapting a program using the approach, and we just thought, yeah, this has got to make sense, because the attrition rates are so high, and particularly early on, so that you're not even beginning to set the scene and work with people if if they're dropping out. So just getting engagement beyond the first session would have been a real game changer, and this was clearly going to be a way of doing it. So that was it for us, I think.
Okay.
I'm on mute.
Yeah, I think the last.
After the PhD, would you have liked to have done further studying?
Oh, yeah. Yes, I'd like to do another PhD, because I loved. My favourite thing was doing a PhD, but I certainly, from my point of view, PhD-wise, I would like to do some kind of rigorous evaluation on using the solution-focused approach, using strength-based approaches for partner-violent men. I'd really be keen on doing that, because it's very difficult to kind of. I mean, I've done some. Well, evaluation isn't the right word. I don't know what the right word to use is. I've kind of assessed some. We work with a Mentoring West Midlands, and I've kind of done some assessments on their implementation of using the solution focused approach. But it's not a full evaluation. It was some qualitative research, just understanding kind of how they implemented it and what individuals' experiences were of it. There were some really promising things that came from that, so I'd like to kind of do a fully fledged evaluation.
Yeah, I think one thing that we've always said, Kate, isn't it, is that actually we haven't really got that many good measures around of strengths-based approaches to offending behaviour programs. So quite often you've got this instance where you've got lots of people using the approach, but not many good measures out there that really, I mean, there are some now, thankfully, but it's been a long time coming, you know, getting the assessment research to catch up with things so that we've got those tools that we can use to evaluate programs.
But I keep telling you that Emma, why don't you do that? You go and develop all the right measures to use, then I'll go and use the measures and do the evaluation. It would be spot on.
Exactly. Yeah.
And
So,
I was looking at something the other day, and it was saying how less than 1% of perpetrators actually get into a program of any sort, accredited or what. How will this approach, do you think it will encourage more people to take part in these programs?
yeah, I think so, but we've still got a long way to go, really, in terms of really encouraging people to engage with services, because there is, I suppose, still that overwhelming feeling of a deficit model or a problem-based model that you only go and seek out help when something is wrong. So yeah, but it would be great if we could really, you know, kind of see more people engaging in services, for sure.
And
yeah.
I think where it might encourage people is that a lot of intervention providers obviously have, which we talked to you about and we've debated a lot about this, whether people are kind of motivated to change, and that is a selection criteria for coming on. So, well, they're not motivated to change, they're not ready to engage, right? They can't come on the intervention. I think with a solution focused approach, that would never be kind of out there or a criteria at all. So from that point of view, I think it's more encouraging on getting people to come and you know, do the intervention.
Yeah, it has to be regarded as a treatment target, hasn't it, really, rather than a treatment requirement, because not everybody has necessarily got the idea of change in the forefront of their mind in terms of them feeling that readiness for change. But we really firmly believe that if you can start to develop curiosity that people will about what could change and what would that look like if you could make some changes, that curiosity really can lead to people being in a much more ready position. And that's what we need to do, because if we can somehow encourage that, then you're going to naturally encourage people to engage with services. But maybe there has to be that kind of pre-program work to get people into that. And actually, when Erica and I first worked with a probation trust, what we actually did was we developed the first of its kind. It was an assessment. It was an offender assessment program using a solution-focused approach. And it was called Getting to Know You, because that's all it was. It wasn't about therapeutic, right, let's try and work on some ideas for change. It was purely getting to know you, who you are, what you're about, the relationships that are important to you, the people that are important to you, and rethinking how we assess people. And so that's how we started. And then it was kind of a lovely segue into then a solution-focused treatment program. So it was kind of threading it through right from the get-go all the way through, using that approach.
Yeah, and I guess I'm curious, do you engage people on one-to-ones in the programs, or do you have group provision too?
I think they're fundamentally written for both scenarios, John. So fundamentally, group work there's definitely some big wins in group work, but we've worked with organisations who actually deliver them on a one-to-one basis, because pragmatics have only allowed for them to be delivered one-to-one, particularly in prison. Where group work certainly at the moment is impossible. I mean, I
was going to say, we've also developed, haven't we? So you can almost do it a rolling, that you start on a one-to-one basis, you then have the main content as a group, and then you finish it on a one-to-one basis.
Okay, yes. And any sparkling moments that come to mind when working with perhaps some reluctant perpetrators? Do you call them perpetrators, presumably?
We try to actually avoid that term. It's an interesting one, particularly when we're kind of from a research purpose. If I'm writing about it, I tend to have to use that term for kind of understanding, but we like to use what people who are delivering it like to use it with clients or service users.
Yeah, okay, yeah. So with particular service users, particular clients, some sparkling moments you can recall of success.
I mean, it's quite a difficult one for us from the point of view is that we tend to not do a lot of delivery. So we do the training, but don't actually run groups ourselves. But we have done some. I mean, for me, the couple of moments are, there was, I sat in over and kind of co-facilitated for my own development of one of the organisations we work with. And there was one where within the group setting, there was just a chap that really got it, really understood it, and was really developing really good solutions for his behaviours. And was reporting back, and you could see how well he was doing at home. But he then kind of became more of an oracle than we did. So, you know, if some of the other service users were perhaps struggling, or they would start perhaps blaming, or perhaps using problem kind of language, it wasn't us that was speaking or saying or trying to ask the questions. It was the service user, and let's call him John. And it was who would then be saying and asking the questions and kind of supporting and helping the other service user. And for that, for me, was a great moment. And then other moments are when people actually out of the group that we were working with, you know, like I would perhaps do something not particularly, you know, I would perhaps say, there was one occasion, because my background was lecturing, and I find it really hard. I do see myself as fixed, and I find it so hard when I'm thinking, well, it's obvious what you want to do is. I can remember on one occasion going, well, why don't you try this? And the group members went, you're not meant to tell us what to be doing. You know, why are you telling us that? How are we? That's not what, you know, that's not what I want to do. That's your opinion. And for me, although it was kind of me thinking, oh yes, I shouldn't have done that. For me, it was a good moment of, gosh, they're really understanding this and really embracing the approach.
I can actually remember as well, I think co-delivering a local organisation, and there was a chap on the programme who was just finding it really, really hard to try and work out what he needed to work on, what he needed to focus on. And he would go and pick his daughter up from school, and he would, and for some reason he used to get really upset and frustrated because there would be other parents on the playground who knew that he'd been arrested and he'd been in trouble, and he found that very hard to cope with. And he kept sort of fixating on this problem of keeping calm. And so we spent a bit of time examining why that might be the case and talking through instances where he'd managed to keep his cool and where things had actually worked. And he hadn't been engaging very well up until that point. And I just remember saying to him, are you going to have to go and pick your daughter up over the next few days? He said, yeah, and so I said, can you try? So he'd come up with an idea about something he could do to try and keep himself nice and calm. So I said, can you make some notes on it for next time we meet, for next time you're here? Because I really think this is going to be really useful for you to be working on. I think this is going to be really helpful. And I kind of didn't give it much thought, but I remember just so inspired, because the following week he came and he'd got this page and he'd made all of these little notes about the things that he thought had worked. And he just looked totally inspired. Like he just, there had been a bit of a moment there where he just thought, right, okay, I can do this. I can really do this.
Yes. Wow.
It's just lovely to see from him, literally not engaging, having that kind of body language that said, I'd rather be anywhere than here. And to go from that to sort of coming up with this kind of his list of things that he'd made notes of was just, really lovely. What about you, John, in your work?
What sparkling moments?
Am I allowed to ask? Yes. Just curious about your sparkling moments.
Yes, I think one comes to mind actually of a woman in her 50s, I suppose, and she was a survivor of child sexual abuse, and also consequently was also bullied at school and at work, and was still being bullied at work and bullied by her so-called friends. And over the period of about 6 sessions, she, from this sort of slumped, low self-esteem lump, she sort of blossomed, you know, and head up. And on the 3rd session, she said, "Do you know, John, since I saw you last time, I've been reviewing my so-called friends. And they're taking advantage of me. They only knock on my door when they want something. So I'm deciding who are my real friends and who are rather leeching on me and perhaps abusing me in some way." And that was a real turning point. You know, I thought, wow, you know, and she got it straight away, how she needn't be victim anymore. She could actually be seen as a survivor and on the way to thriving and living her life well.
Yeah.
Oh, that's just wonderful, isn't it? That little turning point.
Oh, it was there. You know, how can you measure it? You know, they're worth their weight in gold, aren't they? Those little moments.
I think what this also highlights is kind of how you can use it for so many different aspects. Because I mean, I'm really obviously interested in the stuff that you do with kind of suicidality, because I've got no experience in that, and I think actually I almost, and probably still will be now, almost a bit fearful of using it in that environment, only because for me being out of my depth, not knowing about it. But the work, kind of stuff I've read about you and some of the stuff is really fascinating with, you know, as I said, you can do it on such different things. And I mean, some of the stats that I think it was the video I was watching that you've done, they're amazing for some of the results you're getting. I mean, so I can probably do that evaluation, couldn't I?
Yes, you could.
It's a little opportunity here, Kate.
Yeah.
Well, that brings us nicely on to Catherine's question. How widely now is SF being used in this way, and what are you hearing is the success rate? So I assume in terms of working with participants or service users.
So, I mean, for domestic violence, I mean, I don't think it's widely used, is it? And certainly for evaluations, there are very little. I mean, there's anecdotal, and as I said, I've done a couple of kind of qualitative. I can't use the word evaluation, but you know, kind of understandings of how the participants are experiencing, what they think of it, the outcomes they talk about. We've got some slightly harder measures, and I'm actually about to do another kind of snapshot of mentoring West Midlands, their mentoring program, which uses a solution focused approach. Again, I should be interviewing the service users and also hopefully trying to pick up some reoffending data. But there just aren't the evaluations out there, so it's really difficult to know or measure or give evidence of measures of success.
Yeah, I think that is one of the challenges is capturing the level of success with these programs. And I think there are certainly more and more strengths-based approaches around than there were when Kate and I started, because they were all offence-focused programs that, you know, anybody that was in prison, they were all offence-focused programs. I'm sort of healthily sceptical about the degree to which programs are entirely kind of strengths-based, but they certainly have more of a feel for being strengths-based than they used to.
It can be
but
quite.
I don't know.
No, sorry, I didn't mean to interrupt. Because I was saying, you're saying about how strength-based they are, because we looked at trying to work with some organisations, kind of to develop some more, and them that use strength-based approaches, but that we just couldn't get hold of manuals, or so we didn't know what they were delivering to be able to assess how strength-based they were. We were just told, no, they are strength-based.
Yeah, they're quite reluctant to actually see what's in them.
And what was interesting when we approached you guys and the training that we've had, and the one thing that stuck out for me was like you're saying, a lot of programs would want the participant client to, admit guilt. I'm a bad person. This is, I need this support, and almost holding them responsible for the violence that they've used. And you told us that our aim is to hold them responsible for the positive choices that they make. So there's a different focus on what we're holding them responsible for.
Yeah, accountability. Yeah, because I think a lot of kind of misconceptions are that solution focused approach is a bit fuzzy. It's a bit just being nice to each other and just being a bit positive, and we'll clap our hands and isn't everything great? And actually, using a problem-focused approach, it's much better because you're accountable for your problems, and we're going to make you admit to it all, and we're going to make you talk through it, and that's how it should be. Whereas we say, well, no, it's actually really much harder being accountable for your solutions and implementing the changes you're making and continuing to implement them than it is, because actually it's, perhaps being a bit flippant, it is quite easy to be accountable of, yeah, I did that, yes, I'm a bad person, yeah, I've done this. Actually, it's really difficult to be accountable for, this is what I'm now doing, and actually doing it and being able to come back and show evidence of that, as it were.
I think the other thing is, Joe, for me, I think that there are a variety of reasons why people that have had behavioural, particularly violence, there are reasons why they might be in a position of wanting to deny or just minimise the things that they've done in the past. And there are a variety of reasons that they need to hang on to that. And in some ways, it can be a bit of a protective factor, because to suddenly kind of be confronted with all the things that you've done in the past that are wrong has got to be dealt with really carefully. And, people will naturally come to a point in their life where they'll come face to face with their past and recognise the things that they've done, but that it has to be on their terms and in their own good time. And they have to go on that journey to get there. And I think we have this impatience that we kind of, we need to see change happen right.
Emma, you're breaking up.
Right, I am going to try and plug myself into the Wi-Fi Bluetooth and see if that will work.
Old school.
Yes.
I'm just now going to walk you around my house. I'm going to try and plug in the Wi-Fi.
It's good to see how well decorated it is.
Yes, not that we're looking, but John and I are extremely
We're
pleased.
impressed, aren't we?
We are definitely impressed.
Yeah.
Can you hear me now? Is that any better?
That's better.
Yeah.
I'm in my solution focused zone now.
Yeah.
No, I don't know at what point you lost me, but I was just saying, about that kind of, when people come to terms with some of the things that they've done wrong, it kind of has to be in their own good time and on their terms, really. And that's their personal journey. And we can only hope we can maybe nudge them along that way. But to try and force somebody to be accountable for everything they've done wrong It's just counterintuitive. How on earth are you going to ever be able to help build resources and capacity for strength with that person if you're having that kind of conversation with them? So yeah, definitely is. It's about accountability for the future and what's going to start working.
John,
And I'm curious if I can chip in here. Those that you train to run the programs, are they prison-based, or are they probation officers, or other types of staff, or lay people?
It was kind of probation in the early days.
Yeah.
And obviously then organisations such as Aisha and Joe's, and then other organisations, many charities that work with people that have got problems with violence. And actually it's interesting you asked, John, because you know we probably found that particularly in the early days that the people most resistant to the facilitators we were training, actually, who are quite wedded to the problem-based approach of making people accountable for problems, because how can you possibly work with them unless you make them accountable? And it's quite difficult to kind of encourage people to see things a little bit differently. You know, it takes some doing.
So we were
I don't think, Aisha, that you were too keen on the approach. If I remember when we first spoke, you admitted that when you first came across it, you weren't too sure.
You liked it, did you?
No.
You're going to walk out.
Yes.
But
I don't shy away from that story. Everyone knows I didn't like it at first.
But you just said there, you kind of said, oh, so we were easy. And I'm not just saying this, but actually out of the kind of charities we've worked with, you do tend to find they do tend to kind of recruit like-minded people who naturally seem to have this solution-focused approach, and who do embrace it and who do get it. So yes, you're absolutely right. I mean, we joke because the first time we did do training with probation, it was hard work. Emma and I did joke that we said, oh, we've earned our money. We were absolutely shattered by the end of it and really worked hard. And then, like, when we did the training with you guys the other week, we had a lovely time. That's really lovely.
Yeah, and it was... Sorry, go on, Emma. Was you saying something, Emma?
No, I was just thinking, because I wanted to ask you both about the culture that you've developed with your organisation. I mean, you from the roots up, it's been solution focused, whereas with probation, you're working with a cultural environment that's through decades and decades and decades been problem focused. And so that's like trying to move it's not like a speedboat that you're trying to turn around. That's like an oil tanker to try and really get some shift. But you did it from the roots up, so to speak, didn't you?
We were from a school background, so it was pretty much not dissimilar to probation. Crime and punishment. You did something wrong. This is what you did wrong. This is what the punishment's going to be, and because I've punished you this many times, you're going to turn straight because you don't want this punishment anymore. But then we've got to ask yourself, why do I keep seeing the same faces in detention every week? If punishment worked, what is going wrong here? Because do I up the punishment? That's what we did. Fridays, 2 hours, 2-hour detention. And it was the same faces every week. You feel, something's not right, something's not working. So from that kind of institutional background, and then having that 2-day training with brief when Harvey came down, and what Aisha didn't like was he said, you don't need to know the problem to affect a solution. You just need to know where the client wants to go. And I love it. That's like you were saying, Emma, it's like kind of a light bulb moment. Because if I opened up the conversations we have with families with what the young person's doing wrong, he's going to shut down, he's going to blame everyone else apart from himself, and he's going to walk out. And engagement is so vital, because you need that person to want to come back. I don't know if the family's ever going to come back again. I might only get one shot at this. So do I want to sit there and you tell me everything that's gone wrong in the past year or so. And obviously we need to listen to that. But yeah, when Harvey came, it was like, it was almost like I was doing some of this with the kids, but didn't realise what it was. You know, that always knocks on your door, sir, kick me out again. Oh, why did he do that? He hates me. Oh, really? So, and it was like, when you let him offload, yeah, he hates me, he's always kicking me out. Blimey, really? What? So why do you think he kicked you out this time? Oh, I don't know. And then you kind of discover that he got there late. Again, really? So if you got there a bit earlier, what do you think sir would do then? Oh, I don't know. Do you want to try it? So it was almost there, but I didn't know what it was.
Yeah, I think it's interesting you say that, Joe, because I remember when we worked with Mentoring West Midlands, and I remember sort of talking to Chris about it, saying, well, you know, things keep changing over the decades. The research is pointing to it now. Who knows what will change? And he said, no, it's always going to be right. It's always going to be right because it's based on what we know about human beings. And that like we were saying earlier, you know, when you see something and you think, of course, there was that warm, almost familiar feeling, as if, you know, it wasn't brand new. It's like, no, this feels completely like it's the right thing to be doing. And so it's interesting you saying that you were already doing it. You just didn't know you were doing it. The same as we say about clients is they're already doing things to stay out of trouble. They're already managing things. They just haven't really been asked to focus on those times when they're managing it. So it's the same kind of concept, really.
What about you, Ash?
What about me?
Well, when did you suddenly realise it was for you? When did you stop fighting and come into the fold?
For SF?
Yeah.
It's when we went to brief. No, we didn't. Yeah, we did. We went to brief training and in Covent Garden, and Elliot was there. And as he was talking, because I was reluctant, I didn't want to be there in the first place. Joe had just wasted charity money again. And as I was sitting there, just all of a sudden just went, oh, I get it now. Penny just dropped all of a sudden. I get it. But then I left it there until I actually witnessed Joe in a session with a mother and daughter. And I didn't even ask their permission. I just plonked myself there. Just sat next to Joe. I was like, just excuse me, carry on. And he ran a full session. And to see their faces, it was just completely surreal. And so, between Joe and Elliot, I conformed. I went I left the dark side, let's say.
What were their faces saying to you, Aisha, then? You know, when you said look at their faces, what were they?
They was just so relaxed, and they were laughing, and they were facing each other. And this is a mother and child when there was a lot of, you know, physical violence going on between them. And they were just looking at each other with hope. Like, because Joe was asking the right questions. And he was listening to them.
Yeah. Can you remember the questions, Joe? Can you remember what you were asking?
I remember this mother and daughter because I think it was the first time, and I don't know for you guys or anyone listening, but when you first learn the approach, you can be a bit tentative with it, and you kind of, I'll try a bit of scaling. I might try a little bit of the best hope. And I think this is the first time where I thought, let's just do it from A to Z. What are your best hopes? Miracle. The scaling, I used a mountain. I don't know why. Something said to me, use this mountain with 10 different sort of posting points, and this is where you want to be, and this is where you are. And sometimes the weather's a bit bad and you get stuck and you might have to go down a bit. And it was just, I remember when the mum first knocked on our door and she'd been to an adult sort of counselling session for depression. And she was in tears, and they said, her daughter has been, how old's her daughter? She's 21. Yeah, but we don't work with 21-year-olds. But how can you say no when the mum was there sort of in bits? So the most beautiful moment for me, and I don't know how the conversation happened or started, but her mum was a nurse, and she said when she was a baby, she was in hospital, and the hospital were trying to discharge her, saying there was nothing wrong. She said, I knew there was something wrong with you, and I insisted that they keep you in. And if she hadn't have kept her in, she wouldn't have survived. And she held her mum's hand and she said, you saved my life. And that was just an amazing moment.
Yeah.
Never forget it.
Wow.
I was there and I forgot it. Sorry.
Yeah. She held her hand and stroked her hand and said, you saved my life, man. So I don't know what about you, John? Anything that sticks out?
In what way particularly?
Even just a moment like that. It's just when she held her hand. It was so special. I don't know. It's one of those you don't forget. I'm just wondering if there was.
Yes, I'm trying to think. You get these sort of real sort of tender moments, don't you? And I think one thing about the solution-focused approach for me, because I came across it in 1993, so I had the pleasure of having a 2-day workshop from Steve DeShazer.
Oh.
And I was just blown away, and just thinking, as I said to Joe and Aisha before, I just thought I can just see the potential for this approach. And I think, Joe, you talking there has just reminded me how, because this is such a respectful and empowering way of working, you just get that connection with people. And, and I think it's the one down approach. We're looking to the client as being the expert on their lives. And when I first went into mental health services, we were the experts, we were trained, we knew best, and we would tell clients what to do. But it just turns all that on its head. And it's that respectfulness, that empowering, and that affirming of clients who then start to do things well. And, you talking earlier, Emma, about that DVD, and Insukenberg has this amazing way of affirming clients without uttering a word.
Yeah.
Just by facial expression and body language.
Yeah.
I think
I was just going to say what you're describing there, John. I mean, because we've always known from the research that the single biggest predictor of program success is the therapeutic alliance, that working relationship that the facilitator and client build together. And so I guess it's a no-brainer then that the solution-focused approach works, because it's completely built on the idea of collaboration and that kind of equal stake, so to speak, in seeing things work, and that there is no power here. It's not about that. It's about working together. Very jealous about Steve DeShazer back in 1993. Where was that?
That was at the Institute of Child Health in Tavistock Square, would it be, or Tavistock Place in London?
Yeah.
Yes.
Yeah.
I think I got that right.
Yeah, that is good training. Yes. So, but I was similarly to Emma thinking about what you said there, John. Is I really like what you're saying about the kind of empowerment and respect, because if you get that, you're more likely to get people engaging and working with you. You go on kind of problem-focused models where you're actually, first thing you're doing is accusing people of their behaviour, or possibly, if they're denying it, not believing their version of events, and you're automatically going to get a kind of a situation where you're butting heads. So at what point are you going to get any engagement from the participant? And to be fair, it might be quite difficult as a facilitator to engage yourself if you're actually just head butting and having an argument. But as you said, with empowerment and the respect, and I think you also spike people's curiosity, because I think a lot of particularly partner violent men who come on our solution focused, who have been on other programs, they're kind of expecting to have this kind of standoff to start with, and, you know, interrogate about all the things they've done. And I think by not doing that, with respect, we also, as I said, give them this curiosity and almost stun them into, why aren't you asking me about that? Oh, you're actually interested in me. Oh, well, I'm the expert in me. Well, yes, you are. And that kind of builds these relationships, doesn't it?
Yeah, no,
I
for
think,
sure.
I think that's where it stands out as to it really truly is a non-judgmental approach. And I think in many policies, in many paperwork of charities or statutory, non-statutory organisations, you will hear and read, we work with clients in a non-judgmental approach, but actually labelling them as perpetrators in first instance, you're judging.
Yeah.
Yes, they have committed acts of violence. Yes, we're not taking that away. But already there's that resistance. You are here because you are a perpetrator.
Yeah.
Rather than you are here so we can look at preferred behaviours that would suit you and ultimately your children or whoever around you. And it's that shift, isn't it? Why do you think that shift is so important?
I think it's about giving people control, or that sort of control over their future and their lives. And I mean, we've always said, that the clients that the programs are intended for aren't resistant to change, but they just don't want to be changed by someone else or by something else. And I think it is just about letting them know that they have control over their future and that it doesn't have to look the same as their past, that they can have that view. And the miracle question is a lovely way of getting clients to be able to look very much at a future where the problem no longer exists. And for some people, that's very hard to see. But the miracle question I love because it gets the client there in about 10 seconds. It would ordinarily take you a long time, especially when clients are fixated on problems, to be able to see a life without the problem in it. And it's just amazing that one question can do that.
Yeah. And again, with the approach and the questions that are asked, it's always asking the client to have a role in the change. So it's not everyone else changing and I just remain the way I am. But, if your mum was to nag you less, what difference would that make? Well, I'd be happier. And if you were happier, what would your mum notice about you? There's this lovely little tango that we do. Whereas eventually the young person thinks, maybe if I did it on the third time of asking instead of the 10th, I might actually get a different response. Yeah. So it's that lovely way of having a conversation where eventually I begin to understand that, okay, I would like everyone else to change, but I do have some responsibility in the sense of I need to do something different as well.
But do you know what that's just made me think of, Joe? I remember when my eldest son, Benjamin, was a baby, and you get those little mats with the things that like the arches, and I remember being fascinated watching him slowly discover cause and effect. If I push that, it pushes that, and he'd just be doing it for hours on end, the way babies do, because as human beings, it's that whole cause and effect. I can actually make something happen by doing this or whatever. And it's almost getting into that lovely position with a client of getting them to experiment with their behavior. Why don't you just try? What happens if you try this? What do you think? And getting them excited about what little things that they could do, that and the effect that those things could potentially have. But that's an innate thing, isn't it? That we like to cause and effect. We want to experiment and look at the different effects we can make from just tweaking things just a tiny little bit. And that's what, again, I love about the solution focused approach, is it doesn't have to be big. It can just be tiny little things and just a little nudge there, and suddenly the effect is very, very different.
That's interesting you say little steps. My supervisor and colleague, she always talks in terms of baby steps rather than little steps or small steps. And I love the use of baby steps, because babies, of course, can grow into toddlers and then grow even bigger.
Yeah.
But she always insists with any work she does with clients, go for the baby steps, because they're easily achievable and they're quick wins, if you like, for the client, who can then feel better about themselves. And then, of course, we can compliment them as a result.
Yes, I like that.
Yeah, I do love that as well. And I think, yeah, like you say, quick wins. You want to get some really quick wins under the belt early on to really get that curiosity and then get the engagement, and then easy street.
Yeah. And it gets that momentum, hopefully, that forward momentum.
Yeah. Snowballing effect, isn't it?
We've got time for one more question each, John and Joe.
Ooh. Oh.
After you, Joe, give me time to think.
Because I know we're going to be talking again in the future, and hopefully you will help us evaluate the program that we've got together. So that will be really fascinating. So I'm looking forward to that. Is there anything you guys are looking forward to down the road that you're?
Well, we absolutely love doing the kind of work that we've done with you and Aisha, Joe. We absolutely, don't we, Kate? We always say it's just the most rewarding work, and so I think for us, we'd like to do more of it, and in a variety of ways, because obviously we create a program, but we tailor it for the people that are actually using it and delivering it in the context of your work. So we kind of use the research to provide the evidence base, but then we also need to know from you guys, well, what works, so that you've got something that's really fit for purpose, that really helps you thrive in the work that you do. So, we're just keen to do more of it, and in a variety of contexts. I mean, as Kate was saying, it's mainly been males that have been convicted of domestic violence offences, but there's a whole range of contexts out there where this could really work. And so, yeah, that's what I would like.
That's definitely the same for me, kind of more of the same. I do, as I said, like you heard at the beginning, I do kind of do this because I do also love doing the evaluation stuff, but they won't let me evaluate my own work, which is a shame. I'd be fair. Yes. Yeah.
Well, we've got very good colleagues that can do that work, Kate.
Yeah.
So.
Yeah. But yes, definitely for me, it's more of this with going forward.
I love that. I'll evaluate your work for you, Kate.
Lovely, thank you.
Yeah, I'll give you gold stars. Can I put little hearts on it?
Oh, perfect.
That's right up Kate's street. You show her a couple of gold stars and some stickers.
Yeah. There you go, see? Show that to the other academics. Look, I got a gold star.
Yeah. There you go.
John, have you thought of a question?
Yes, one for Kate, really. I was in your work somewhere, Kate, I remember reading you're interested in increased quality of life and well-being.
Yes.
In a couple of minutes, could you say something about that? Because that fits with my interest in thriving, after trauma.
This is kind of a new area for me. So this is my NHS work, is that we're working with older forensic mental health patients who seem to get kind of stuck in the system. And I'm just part through interviewing. I've interviewed staff and I'm about to start interviewing patients about what is quality of life for them, how they can get good and improve quality of life, how they can get good and improved health and well-being, and kind of what are the barriers and facilitators to them progressing and doing better in the system and kind of moving onwards and out. So it's really interesting. Yeah, it's a really interesting study.
Yeah, I bet. Fantastic work. Yeah, great. Yeah.
And we've actually come to the end already.
Yeah.
And quickly.
That did go very quickly. Just getting warmed up.
I know, right?
We need a solution focused festival that goes on all day. That's what we need.
Well, SF24 is coming up in a few months. That's 24 hours of solution focused talk. which I will be speaking to you, Kate and Emma, privately later on about.
She's basically already put you on it, so you've got to just go with it.
Well, I want to
just send us the time and the place.
Yeah, I want to put them on there. But yeah, any last words, Joe, John, Emma, and Kate, and then we can say goodbye.
I'd just like to say that thank you for pushing me out of my comfort zone and making me do this. I must admit, I was a bit to do this, and it's obviously lovely working with you two, but it's also really, really lovely meeting you, John. The work that you do has been a real interest. So that was a very nice surprise to see you sat there.
That was a very nice surprise indeed.
I had no idea, John.
I wondered, yes, because from our conversation a couple of weeks ago, yes, I thought I was a surprise.
Very
John,
lovely surprise.
I didn't even know it was you, John.
Oh, did you not?
No.
Oh,
but I do,
right.
to be fair, I do say to Aish, don't tell me, I want to be curious, I want to be surprised.
Yeah.
I will also confess, though, that Emma and I beforehand were going, what happens if we don't know who it is? And when you came on, you could both see it, go, oh, God, we know.
Funny, I was looking at my LinkedIn account this morning. I thought I saw your names pop up. I thought, oh, shall I put in a request to, what's it, connection request? I thought, no, I better not, because this might spill the
surprise.
Yes.
You can do it now, John.
Yeah.
All right, I'll do it now. Yeah.
You're allowed to do it now.
Please do.
No, and I a few words. I just say it's lovely to meet both of you, Kate and Emma, and I'm always interested to hear of other specialties that are using the solution-focused approach. There's been so much written about how solution-focused is effective for all different areas. And there's the book I always have on my desk here, which is the Cynthia Franklin one. Which is solution-focused brief therapy, the handbook of evidence-based practice. So you talking about evaluation, Kate, would be, that's another entry for this book, later edition. And a colleague of mine, Alistair McDonald, he's always looking at new work and new specialties that are proving that the solution-focused approach is really efficacious.
Yeah.
Yeah.
No pressure, Kate.
Yeah, no pressure, guys. No pressure.
Yeah.
But there you go. Don't say we don't support networking.
No.
Absolutely, yeah.
An amazing job of that.
In a nutshell. Right, yeah, thank you so much for joining, everyone. John, Kate, Emma, Joe, you're always here with me, so you're all right. It's been an absolute pleasure, and on behalf of Family-Based Solutions, we are forever in your debt. You've both worked so hard to support us, and what you've produced is absolutely amazing. The training was absolutely fantastic. So anyone out there that's thinking about producing some form of solution-focused training or otherwise, do get in contact with Kate and Emma. You can email me and I will get you their contact details. They are absolutely fantastic. And it's honestly a pleasure to know you guys, and I can't wait for further training. Sorry, go on.
I was just going to say, oh yeah, absolutely, bring it on. We love working with you, we really do.
Yeah,
You've got a
so
great team.
If anyone else is as nice as my team and Joe's team, get in contact.
Yes.
Only if you're nice.
Yeah, that'd be nice.
And John, you're a superstar. John, we just love you, John. We
love you, John.
We just got to do that.
I didn't know you at all this time last year, and I love you too now. It's just, the love is all shared, isn't it?
Oh, John, does that mean next year we can look forward to your
Yes.
Great.
We've got a reunion in a year's time. We've got a little heart in a year's time.
Well, I've challenged Rob Black to arrange a date and a pub.
I know.
Didn't we, John?
Yeah,
just send us a date, send us a pub, and we'll just all meet there.
Yes.
We just all get on the train, get on the plane, whatever we need to get on, walk. We just get there and just walk through the doors. But the thing is, you'll be like, who do I hug first?
Gosh.
I mean, that's a very difficult decision. I mean, that's an FBS chat discussion on its own. How
Yeah.
do we define who we're going to who we're going to hunt? But can I just ask you guys to wait right there? Don't press any buttons. Don't push anything, so we can say goodbye personally. But to everybody else, thank you so much for watching and listening. And on Wednesday, we have Jesper Christiansen, who we love. He's an absolute delight. And he's very, very good with sharing resources. And that's another reason why I love him. He's absolutely amazing. And on Thursday, the 25th, we have Eve Lipchick. Yes, I can't say that without smiling. We have Eve Lipchick with us on Thursday, who's meant to be retired, but she can't say no to us because she already loves us. So it's all cool.
Because you stalked the poor lady.
I did stalk her a little bit. Just a little bit. Just a little bit. So we'll see you guys on Wednesday, hopefully. Bye.
Thank you.